In Wisconsin, 14 people are now being tested for the virus, but still only the one confirmed case. That person has since recovered. In the state of Washington, health officials confirmed the U.S. coronavirus death toll has now risen to 12. They say the latest victim was a woman in her 90s. Although doctors say the overall risk is still low, there are certain groups who can be hit harder.
Gabriella Becerra joins us with how those groups are preparing.
Well, those who are elderly or living with underlying conditions fall into the category of being more at risk of contracting the coronavirus. Assisted living communities in the Madison area are preparing for the worst while trying to educate their staff and residents.
We have the Sani cloth wipes that we use to do the handrails, the doorknobs, the walkers, the wheelchairs, the tabletops.
Coventry Village is stocked up on supplies to prevent disease and focused on education.
We want to keep them informed and make sure they understand how it's spread, how we watch for signs and symptoms, and how to answer the questions that families may bring up to them.
Assisted living communities, including Coventry Village, Attic Angel Community, and Brookdale Senior Living, all say they're following CDC and World Health Organization guidelines and are preparing for the possible scenarios where coronavirus spreads to Wisconsin.
Making sure we had everything in place to do a lockdown if we needed to.
Chief Quality Officer at UW Health, Jeffrey Pothoff, clarifies who is most vulnerable to coronavirus.
We know that as you get older, your risk of having coronavirus or having more severe coronavirus increases.
Mortality rate can be broken down between age groups. 50 to 60 years old is 1 to 3%. 60 to 70 years old is 3.6%. And 70 to 80 years old is 8%. Over the age of 80, the mortality rate is 15%.
The difficulty with mortality rate numbers is usually when an epidemic starts, mortality rates are actually projected as higher than what they really are. And the reason for that is it's a lot easier to identify sick people than it is to identify folks who are infected but are not sick.
Pothoff says studies from China show that those who have underlying diseases are also more at risk. There wasn't enough data to show statistics for pregnant women. And as for those of you who are healthy, Pothoff says risk is still low in Madison.
I don't think anyone needs to panic, and we're taking all the necessary steps to prepare for any scenario, whether it's a small number of patients, a medium number of patients, or a full-blown pandemic.
UW Health has received approximately 100 calls since a hotline to answer questions about the coronavirus began yesterday. Pothoff says a healthcare professional is answering those questions factually and based on available information. That hotline number is 608-720-5300.
Good to stay on top of this. Gabriella Becerra reporting tonight. Gabby, thank you.